Good evening, everyone. I am RCDSO Registrar and CEO Dan Faulkner. Thank you for taking time out of your busy schedules to join us tonight. This is our second RCDSO Connect event of 2024. For those of you that missed our February 28th session on the Professional Liability Program and how to avoid complaints, I encourage you to visit our YouTube channel to watch the recording. Recorded RCDSO Connect videos are eligible for a Category 3 CE point. We do these sessions to connect with you and to keep you informed and updated with our work. I attended the ODA's annual spring meeting a few weeks ago, and I spoke to many dentists while at the college's booth who were very complimentary of these virtual town halls. It was important for me and other college staff to be on the exhibitor floor at the ASM to remind the profession that we are here as a resource to help you in your practice. We want to be seen as accessible and a trusted source of information, and these virtual sessions are an example of our efforts. But this is just one way we communicate. We're also active on social media. We post regularly on our website. We send out newsletters and council updates, as well as e-blasts to the profession and stakeholders. To begin, I would like to recognize the complexity and privilege of gathering online today by sharing a land acknowledgement. The RCDSO is on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, known to some as Toronto. Toronto is covered by Treaty 13 with the Mississaugas of the Credit and is home to many diverse First Nations, Inuit, and Métis peoples from across Turtle Island. This land is also part of the Dish with One Spoon territory, a treaty between allied nations to peaceably share and care for this land. We accept our responsibility to each other and this land we live and work on in a spirit of peace, friendship, and respect. We are committed to actively supporting the necessary work towards truth, reconciliation, and equity. We embrace the role we play in regulating dentists, in protecting the public interest, and in strengthening our partnerships with Indigenous communities to advance access to safe and equitable oral health care. Thank you. A quick reminder that this session is eligible for a Category 2 CE point. You'll receive a reference code from me at the end of the session, and you'll be asked for it as part of our post-event survey to verify your attendance here today. With that, we'd like to get this event started by asking all of you a couple of questions. We always look forward to hearing from our participants, and to do that, we use a live polling tool called Slido. So you can see on the screen the slido.com website address. So on your smartphone, your computer, or your tablet, open your web browser and either go to slido.com or you can scan the QR code on the screen to participate. And when you arrive at the site, the code that you will enter is on the screen as well, 3490114. So I'm going to give you a few seconds to join up, and we've got some real quick icebreaker questions just to kick off the evening. So hopefully everyone have been able to locate the site. And we've got our first question on the screen, and you should see it as well on your device. Have you treated at least one CDCP eligible patient since May 1st? Your options are yes, no, or not yet, but I plan to. So we'll give you a few seconds to enter your results. I'll watch the number at the top. So we've got about 124 responses so far, with obviously the vast majority at no, followed by 16 or 15% at yes. So we'll just go for another 15 seconds or so. So about 162 responses so far, and we're staying pretty stable at the no 75%, yes 15%, not yet, but I plan to around 10%. Great. Let's move now to our second question, and we'll continue to gather those results. So the second question is, surveys by the RCDSO on potential standards, policies, or practice issues are a good way to engage the profession's views. Not the only way, but a good way. You can agree, disagree, or you can stay neutral. So again, we'll give you about 30 seconds to enter your responses. So looking at about 170, almost 180 who've responded. Most agree with that statement. Neutral around 17%, disagreeing around 2%. So we'll just keep this up for another 10 seconds or so. We're just shy of 200 responses and we're staying pretty stable in terms of the results. So that's great to see. We are paying a lot of attention to how we consult with the profession, how we form policies and positions, and where we get input from the public and from the profession. And surveys are a very useful way to do that. So thank you very much for your responses. Go now to the last question. I have completed at least one RCDSO survey in 2024. So simple yes or no on that question. So just about 60% yes, have completed a survey, at least one survey. And we're just shy of 200 responses, and we're still around the same results, the same distribution. Just a couple more seconds. Thank you very much for completing the survey. So we're just over 200 now, and we're still staying around the same distribution, around 56, 57% yes, and about 44% no. So thank you very much for helping us understand where you are with respect to those questions. And also thank you for those who have participated in surveys. As I said, they're a really valuable way for us to understand what's on the minds of the profession around some specific topic areas. We're currently seeking your feedback to better understand your experiences and opinions concerning dental practice models in Ontario. So that survey is out in the field. It's live until June. And you can find more information about this anonymous survey on our website by scanning the QR code on the screen. And a link to this page is also available in the chat. Early next week, we are going to be launching a survey regarding the use of artificial intelligence in dentistry. We're really interested in learning about your views to help inform the development of a college document, setting out relevant guidance for dentists using AI. And this will also be available on our website, so please watch for that. Before we begin with our presentation for this evening, I'm going to just spend a few short minutes giving you a brief update on our council meeting that was held earlier today. Council meets 6 times per year. This morning we had a half-day meeting and we discussed a number of topics, and I'll give you a very quick update on a couple of them. We talked about the professional liability program and the divestment. We talked about the emergency class certificate of registration. We also talked about the social contract in the context of access to care. And Dr. Carlos Canones was a guest speaker today. And we also talked about the Canadian Dental Care Plan. With respect to the professional liability program, Council heard today that the college has retained Pricewaterhouse Canada to serve as the third-party advisor to the college for the divestiture of PLP. PwC's job is to ensure that the college's objectives are understood by those organizations who are willing to consider PLP, and to serve as a neutral party for any discussions going forward. We want any future partner to embrace the value of the PLP program for both the profession and the public. And we're very mindful of the excellent staff that we have in PLP who represent that value. So that will be a very critical part of the work that PwC will do with us. Council will be kept fully informed by a subcommittee that they formed to be the key liaison between the council and our advisors. So more to come, and you'll read more about that in our council highlights as well. The emergency class certificate of registration was created last summer, And today, the Council reviewed operational documents to support the implementation of the emergency class. This class of registration or licensure was directed by the Ministry of Health in 2023, and it enables registration of candidates in the event of an emergency, and those candidates may not have fully completed all of their requirements. Now, I want to be clear that this emergency class was not directed at the RCDSO. It's a class of licensure for all 26 health colleges in Ontario. And the RCDSO has taken a responsible approach by requiring significant educational and examination completion, and all individuals with an emergency class, if it is used, will practice under supervision only for the duration of their time in Ontario under that class of registration. And a supervision framework was developed, and it will be finalized soon and will also be available for you to see on the website. Council heard a really interesting presentation today from Dr. Carlos Canones, who's the Vice Dean of the Faculty of Dentistry at Western. Dr. Canones' presentation was entitled Professionalism, Public Trust, and the Need to Resist Our Instincts. I'm not going to try to do justice to this complex topic or to his presentation, but his messages provided valuable data and insight on some of the environmental pressures in dentistry, professional identity within the profession, and access to care and the impact on access to care. Council's meetings, as you know, are live streamed and they're recorded, and the full meeting will be available on our YouTube channel shortly. Dr. Canones is a leader in dentistry. He's an opinion leader, and I would really encourage you when that recording is posted to view his presentation. Finally, Council receives regular updates on the federal launch of the CDCP. Today, Council considered the concept of balanced billing and its impact on patients and dental practices. Council determined that the college will not prepare a position or statement at this point, but we will continue to provide timely and accurate information to the public and the profession about decisions that have been made about the program, and will continue to advocate for program decisions that focus on patient access to care. For those of you interested, as I've mentioned, in the full meeting, it will be available on our YouTube channel, and also stay tuned to see Council highlights that will be circulated in our newsletter in the next month. With that, I'd like to move to our presentation for this evening, where you will learn about the results of our first CE audit using the e-portfolio, and about new opportunities to earn CE points, refinements, coming to the e-portfolio, and pet redevelopment. It's my pleasure to introduce Susan Taylor, who is our Director of Quality and responsible for administering the Quality Assurance Program. And joining Susan tonight is Dr. Nancy DeSanto, a dentist member of Council and Chair of the Quality Assurance Committee. Nancy, I'll turn it over to you.
Thank you, Dan, and thank you all for joining us this evening. We have a full agenda ahead of us. You will hear from me, from Susan, and from one another as we share some updates and answer your questions. Our session begins with continuing education. We will talk about requirements, opportunities to earn points, and we'll share what's new. You will hear about audit results from the first cohort who completed their CE cycle using the new e-portfolio, and learn more about what to expect if, like me, you're one of the people whose cycle ends in December of 2024. We will continue with an update about the PET and the changes you can expect in 2025. We have been working on new questions, new competencies, and a new platform. Finally, we will share a new opportunity to get involved and work with us at the college. When you were registering for the session, you shared your questions. We will address as many as we can during today's session. We have also updated our FAQs, and we'll show you where to find those and other resources available to help you.
Thanks, Nancy. Sorry, there we go. So to start us off, and we wanted to really begin at the beginning and walk you through some of those key areas of the quality assurance program, and in particular, continuing education and the practice enhancement tool. The questions that we had as people were registering for this session, as well as the questions that we heard when we had a booth at the annual spring meeting with the ODA, really related to some of these fundamental pieces of information. So to start, when you look at your continuing education cycle, it is a 3-year cycle. That's what's defined in the Quality Assurance Regulation of the Dentistry Act. Each cycle ends on December 14th of one year and begins on December 15th of the following year. Over the course of those 3 years, you are required to complete 90 points, and there is a specific breakdown that's identified in the regulation. And you'll see this bar at the bottom, the category 1, 2, 3, and total points. That's what we call your dashboard, and that you'll find on the landing page of your continuing education e-portfolio. In this case, what you can see is that you need 15 points in category 1, and in this example, the person has 6 points in category 1. You need 45 points in category 2, and in this example, the person has 48 points in category 2, and you need 30 points in category 3, so the person has 17 points in category 3. What you'll see, and we'll talk about this in a moment, is that the 6 points from category 1, the 48 in category 2, and the 17 in category 3, those total to be 71 points out of your 90 points total. So one of the things that we did very deliberately do when we were building the portfolio is we built this dashboard so that you could see at any given moment how many points you had and what the distribution of those points is, so that you don't have to keep track of them at any given time. They're there for you, it's in your dashboard, and it's always easily accessible. One of the questions that we had in the sign up for tonight's session was, can excess points be used for category 1 to 2, and can they be cascading from 2 to 3? How do they get transferred over? And this is a question that we've heard many, many times. And what we'll see, and what you'll see here in this diagram, is that your points can cascade down. So they can go from category 1 to 2, 2 or 3, and they can go from 2 to 3, but they can never go up. And we saw that in our audits where there were a number of people who had many, many points in category 2, but they still had a deficiency in category 1. So you really do need to watch what your totals are in each of those categories and make sure that you have enough points in category 1 to satisfy that requirement, and recognize that if you have extras, they will count in the other categories. One thing we wanted to showcase though here is you'll see in this example where the person has 5 points out of 15 in category 1, so they're missing 10 points in category 1. And that's what directly transfers over. If you look at the total, you'll see that they only have 80 out of 90 points, even though if you totaled up 5 plus 80 plus 5, you would see that actually says, well, this person has 90 points. The reason it only totals to 80 is because those 10 points that are missing in category 1 are still missing. The category 2 extra points can't go back up the other way and count for category 1. Okay, so that's an important nuance and one that we really wanted to draw your attention to. And it is confusing, which is why we built the algorithms into the continuing education portfolio so that you don't have to keep track of that on your own. Okay, so just to play it out again, so 5 points in category 1, person has, they actually have 80 points in category 2, so 45 of them will count for their category 2 points. That leaves them with 35 extras. They have 5 in category 3 plus these 35 extras, but you'll notice that there's a maximum for category 3. The other two are, it's a minimum. You have to have at least 15, at least 45, but you can only have up to 30 in category 3. Okay. The other thing that we wanted to highlight for you is even though these extra points in category 2 will count in category 3, the bar in category 3 won't shift. You'll still see those points counting in category 2. And the reason we did that is we didn't want people to think that for some reason their category 2 points were diminished in any way. They're not. They're still category 2 points. And the way the regulation reads is that these points can actually be category 1, 2, or 3, this 30 points at the end. So that's why we've done it that way. Okay, so I'll turn back to you, Nancy.
Thanks, Susan. Let's pause now and answer some of your questions. You asked us, if I did some CE hours abroad, for example, London, England, could those count towards my CE hours in Canada? That's a great question. And the answer is yes. You absolutely can use those activities towards your CE requirements. To enter those points, you will go to Activity Type and select Category 2 and 3 courses. Enter the course name, session date, and duration. Then check off Other Sponsor Not in List and enter where you took the course. Complete the rest of the entry and your attestation. Click the blue Save and Submit button at the bottom. You will notice that your entry is pending. Our staff will review it and assign it to the correct Category 2 or 3, depending on your entry. During busy times, this may take up to 15 business days, so please be patient.
Nancy, if I can just jump
Yes.
in for a second. There was a question in the chat that came in asking if they can have all 90 points in category 2. And the answer to that question is no, you can't. You can have 90 points in category 2, and that's great, but you're still going to show up as having only 75 points in total because you won't have those category 1 15 points that you need to have. So you have to make sure that you have at least 15 in category 1, and then all of your other points can come from category 2, and that's terrific. Okay, and there's another question that's around entering courses in category 3, and so we're going to get to that in just a few minutes. So thanks,
Thank you,
Nancy.
Susan. Thank you. You asked us a few other questions about entering points. Some of the RCDSO approved CE activities, such as attendance of dental specialty business meeting, do not appear on the e-portfolio list. To enter those points, go to Activity Type and select Dental Society or Study Club business meetings. Next, enter the date of the meeting. Then, select the name of the study club or dental society from the drop-down list. Please note that study clubs must be approved by the Quality Assurance Committee. You can find a full list on the RCDSO website at the link noted on the slide, studyclubs@rcdso.org. The drop-down list for dental societies includes the most common ones, including the ODA component societies. If your dental society is not listed, please contact us at ce@rcdso.org to let us know. The next question is, why are category 2 and 3 lumped together? It keeps adding into the 2 section and doesn't transfer over to category 3. Once again, this is a great question. When we were designing the new e-portfolio, we looked at our audit results, talked to dentists like you, and learned that one of the most frustrating part of continuing education tracking was knowing which activities fall into categories 1, 2, and 3. Dentists often had shortfalls in their CE when they thought they had all the correct points, but had actually recorded them incorrectly. To solve this, we set up course entries into 2 sections. Category 1 core courses. All courses that fall into Category 1 have been reviewed by the Quality Assurance Committee and are listed on our website. Find a Category 1 course, rcdso.org. To enter a Category 1 course, enter the course date and then select the course in the drop-down list. Category 2 and 3 courses, follow the prompts and enter your information. We've created algorithms that lets the platform do the work in assigning whether the course is category 2 or 3. If it looks like all of your courses are category 2, that means that they all meet the criteria for category 2. And that's okay. As Susan mentioned earlier, if it turns out you have an extra category 2 points, they will cascade to category 3. The next question is, how do I enter a convention? This is a little bit more complicated. When you are entering points for a convention, there are a few steps. Start with your certificates from the convention. First, enter any Category 1 courses as you would normally. Then, enter any Category 2 or 3 courses as you would do normally. Finally, enter any time that you spent in general attendance at the conference. This can include the show floor, exhibit hall, and poster presentations. You will earn 3 CE points for half a day and 6 for a full day. But remember that in most cases, you can only earn 6 points per day. So if you have 3 points for Category 1 course, you can only enter in 3 points for general attendance. Susan, over to you.
Thanks, Nancy. So we've had a few more questions come into the chat. Most of these questions we've either already answered or will be answering momentarily. But I want to just go back. There was one a few moments ago that was, where is it? Was around the AGD and that they're not mentioned as being either Category 1, 2, or 3. The way the regulation is written is it includes anything that has AGD status as being part of the approved sponsors. So those courses would be ones that are qualifying for Category 2 points. When you enter it in, and you enter it in under those Category 2 or 3 courses, then what ends up happening is that the algorithms behind the scenes will let us know which course or which category it goes into. If you enter a course and it comes up as pending, it shows that because we weren't able to answer that automatically, and it means that one of our staff team needs to review it manually. And that may take, as Nancy mentioned earlier, it may take up to 15 business days or 3 weeks in high volume times. We're usually a little quicker than that, but sometimes it does get higher volume. I can tell you that up until now, we have found that between 90 and 93% of all the entries that have gone into ePortfolio from all of the dentists are automatically approved through the algorithms. So for those other ones that we're manually approving, we're learning every time we go through this, and then we are making changes to try and make it more automated. Okay. There was also a question about if you deliver a Category 1 course, can you earn points? And yes, you can absolutely earn points for delivering a Category 1 course. What you're doing is you're entering those points as lecturing. So the difference between lecturing and teaching, so if you go into your ePortfolio and you look at the different options that are there, if you're lecturing, or if you're teaching rather, then that means you're teaching at either a university or a college in some sort of an ongoing faculty position. So if you're teaching at U of T or at Western, then that would qualify as teaching points. Lecturing means you're delivering a course. So that might be a 3-hour or 1 hour, whichever course it is. And you're going to get points for lecturing in the same category as the course. And so if the course is a Category 1 course, then you're going to get points in Category 1. If it's a Category 2, you'll get points in Category 2. Okay. So we're going to just take a minute and get you to answer one of the questions. So one of the questions that came to us was, who's exempt from earning continuing education points? So if you go to Slido, so it's the same entry number as what was there before when you were answering the earlier questions. You can either hold your phone up over the QR code that's there, or you can go to slido.com and enter in the number. So we'll see people answering. So you're answering here, who does not have to do continuing education. Okay, so you can answer as many as you want. You don't have to just restrict to one. You can click as many as you think. So these are dentists who do not need to complete their continuing education. Okay. I know there's folks still entering. We're only at about 130, and we're close to 400 online right now. So I will say, we can continue, people can enter, but I will start to talk a little bit about this. In fact, all of the people who are on this list do need to have their continuing education points. So retired dentists who still hold a license. So anybody who has a license with the RCDSO, so if you have a certificate of registration with us, then you are in fact required to complete your CE points. Doesn't matter whether you're retired or whether you're working. And this was an area that we found in our audit last year, where there were some dentists who had retired and they were maybe in Florida for part of the year and back in Canada for part of the year, or they were traveling. And they said, yeah, but we're not practicing, but we have to. So part of the regulation does state that if you have an active license, that you do need to have your continuing education points. A volunteer license is something that's only been in effect for the last few years, and it's a really limited license. What it does is it allows a registrant or a dentist who is only volunteering their services. So they are not doing anything that is generating income. They are only volunteering their services. Sometimes people are doing some mission work in other countries, or they're doing other types of activities, but they're only volunteering their services. And as a result of that, the annual fee is significantly reduced. However, the volunteer license does very clearly state that you still need to have your continuing education points. As I mentioned earlier with the example of somebody who's retired, anybody who's working or living outside Ontario, you do still, as long as you hold a license in Ontario, you do still need to have your continuing education points. So for example, you might be working in Manitoba and you're holding a license in Manitoba and you're complying with their continuing education requirements. But as long as you still have a license in Ontario, you need to have your continuing education points here as well. So that was an area of concern for people. And in particular, it was around their category 1 points where folks said, but I don't live in Ontario. How do I get my points? And so we'll talk about that in a little bit of time, to talk about how it's important to keep an eye on what might be available through e-learning or through online courses, because there are some ways to get your category 1 points. Somebody who's pursuing a specialty certificate. So this is something, again, that sometimes dentists don't realize, but if you've gone back for post-grad training and you are in a full-time postgraduate dental program, you can actually contact us and request an exemption from the current CE cycle or the CE cycle that will overlap while you're in full-time pursuit of this specialty training. It only applies if you're in a full-time program. It does not apply if you're in a part-time program, and it doesn't apply if you're in a fellowship program. But you do need to contact us. So contact us at ce@rcdso.org. In fact, and then the last one, of course, in fact, all practicing dentists are required to have continuing education points. So it was kind of a mean question on my part where I asked who is exempt rather than saying who has to earn CE points. These people all do need, in fact, to earn their continuing education points. There is a comment in the chat, or a question in the chat about what about extenuating circumstances? You know, what happens if somebody isn't able to meet their 3-year requirement due to sickness or family issues, that sort of thing. So we're going to talk about that in a few minutes when we talk about the audit results. So we will speak about that moving forward. Okay, and then there's another question about if you go to a convention outside of Ontario, like in Manitoba, and did a course while you're there, and you entered them under the accurate category only. I think what that question is getting at, so what happens if you go to a convention outside of Ontario? If you won't have any category 1 points likely, because those are only coming from points or courses that have been approved by our QA committee, but you may have category 2 courses. So you would enter those courses under the appropriate category and for the appropriate number of points. And then other times when you're in general attendance at the conference, then those are the times where you would be able to earn your category 3 points for that time. Okay. My best advice, and I know this sounds really confusing, is to go to the prompts in ePortfolio, follow them through, and follow the thread through, answer the questions that are there. And in most cases, you should be able to enter everything you need to have your points counted without any difficulty. So Nancy, I'll turn back to you for the next section.
Thank you, Susan. Another registrant asked us, can I claim CE points for completing the PET? This is another question we hear often. Continuing education and the practice enhancement tool are separate requirements under the Quality Assurance Regulation of the Dentistry Act, Ontario Regulation 2710, Quality Assurance, ontario.ca. You cannot claim points for writing the PET, though if you have spent time preparing for the PET by taking courses, reading textbooks, then you can claim those points through the usual processes. Susan?
Okay, great, thanks, Nancy. So now we have another poll. So this is a question that says, so if my CPR recertification takes 3 hours to complete and it's done every year, how many CE credits can I claim per cycle? Remembering it's a 3-year cycle. Okay, so I see that we still have quite a few people still entering, but right now we're sitting with, there's some people who say that there's 0 points, that CPR is not eligible. There's some people that say 3 points. That's the majority actually have responded that 3 points. And then there's some who are saying that 9 points is what's eligible. In fact, the answer to this is 9 points. So CPR is eligible for every year because it is something that you would do on a regular basis. In many cases, most people do it every year or every couple of years. So every time you take this course over the course of your 3-year cycle, you can claim your points. And you claim points at the equivalent of 1 hour is 1 point. There was a question that came through, so that's why, sorry, in this example, if it's a 3-hour course and you've taken it 3 times, then you're going to enter 3 plus 3 plus 3, so 9 points in total, and those will be in category 2. There was a question that came through and said, well, what about half hours? Because, you know, the course is what happens if something is a half hour. So we do round the points. So we don't acknowledge partial points. So what ends up happening is if you went to something that was 50 minutes, for example, or an hour and 45 minutes, you would get 2 points. If it was an hour and a half, you would get 2 points. If it was an hour and 15 minutes, it would be 1 point. So it is just a rounding. So you enter the time, and the system will identify, you know, which or how many points are associated with that particular event. Okay. Love the questions. There's so many great questions coming in, and many of them are similar to the ones that came online, but there are a few that are a bit different.
Excellent, thank you. So let's look at one last question about CE points. I have all the points I need for this cycle. Can I transfer extras to the next cycle? No, you may only claim CE points in the 3-year cycle in which they are earned. So at the end of a 3-year cycle, you will begin a new 3-year cycle with 0 CE points. We've covered quite a few questions about eligibility for CE and how to enter to ePortfolio. For more frequently asked questions, please check out the RCDSO website or the Help tab on the ePortfolio. You're always welcome to message us at ce@rcdso.org with questions. Susan?
Thanks, Nancy. And please do reach out to us if you have questions or if you're running into problems. We're more than happy to take the time with you, open up your actual ePortfolio so that it's on the screen in front of us, and we're able to work together and work you through this. So I just wanted to highlight a few things that are a bit different than what you might have been used to in the past. It used to be that Category 1 courses could only ever be claimed once. And about a year and a half ago, the Quality Assurance Committee approved for Category 1 courses to be claimed in Category 1 each cycle. So if you took a Category 1 course today in this cycle, then the next time in 3 years' time, you can claim it again in Category 1. So for example, you might there's a course on medical emergencies in the office, or there might be a course that's around ethics that you take, and you take it once now, you may take it again in 3 years, and you'll still earn your points in Category 1. If you decided you wanted to take it a second time in the current cycle, then that time it would count as Category 2, and our system will automatically make the shift and have it go into Category 2. Okay, so if you ever find that you're entering a course and you think it should be Category 1 and it's being bumped into Category 2, just check, because it may be that it is a course you've already claimed in this current cycle. Okay. Another change that we've had is the recent grad bonus. The recent grad bonus is a program that was in effect for a number of years, but we phased it out in 2023 because we were finding that it was introducing a number of inequities just based on the path that individual dentists had taken to obtain their registration with us here in Ontario. So there is no longer a recent grad bonus. There is, however, there's no limit to self-study. That was something that before had a cap on it. And now, after certainly in the last few years with COVID, we recognize how often or how many courses are now available through self-study, through e-learning programs, that sort of thing, where they're delivered asynchronously. So it's not a live speaker. It is something that you're doing at your own pace and in your own order. There is no cap on that. Those are most often are Category 2 or Category 3 points. And so certainly if you're doing self-study, you can earn as many points as you're able to complete in that area. Another thing that is different with ePortfolio is that you can upload your certificates. This was something we heard really clearly from dentists when we were building the ePortfolio, was that they didn't want to have to keep a box of certificates in their basement. They wanted to be able to upload them. You can upload your certificate, follow the prompts, and it's actually quite simple to upload your certificate. If you've decided to upload it, you do not need to keep the paper copy. However, you can decide that you don't want to upload and you want to keep a paper copy. If you do decide to keep the paper copy, make sure you are keeping it for sufficient time that if we were doing an audit on your cycle, that we would ask you for it. We may ask you for it, but not if you've uploaded. So my advice is, wherever possible, upload your certificate. Then you don't have to worry about keeping that piece of paper going forward. And then finally, the other thing that's quite different is audits used to be only on a select number of randomly selected people, and there was a fair bit of work involved in it. And we're going to talk about audits in a few minutes, but we are now auditing 100% of the dentists once they have completed their cycle. Okay. So Nancy, back to you to talk about some new areas in CE.
Thank you, Susan. So in March of 2024, the Quality Assurance Committee recognized Special Olympics Ontario as an approved sponsor for CE credits in Ontario. Special Olympics offers programs to athletes from age 2 to 88 years young. Athletes must have an intellectual disability and may have multiple disabilities. As part of their preparation to health professionals who support the athletes, Special Olympics offers a number of practical educational modules. Dentists who complete these modules can now earn CE points. Dentists are also able to leverage coaching, mentoring, and training that they complete while volunteering with Special Olympics or participating in other activities that support accessible care. This is one other way to share what you've learned about how to meet the unique needs of your patients. Susan?
Thanks, Nancy. So this is actually coming soon to your ePortfolio. And this was a question in the chat as well. So I love the fact that some of the things we've heard before continue to be issues. And so it helps us to see that we are on track for some of our future work as well. One of the things that we were asked about is, well, what about if you are authorized for sedation or CT and you have some requirements for continuing education? Is there a way for us to add that into your e-portfolio? And actually, that is something we are going to be doing in the very near future. So this is an example on the left-hand side, this box. So if you think about that dashboard that you have that identifies your category 1, 2, and 3 points, and your total points, there'll be another section to that that includes if you have authorization in this example for sedation and general anesthesia, there'll be a similar one for authorization in CT. It'll identify what type of authorization you have. Is it oral moderate? Is it parenteral or deep sedation? And it'll identify the authorization date. Then you'll see at the bottom, you'll see this progress bar, and it will be geared to the number of points you need for that specific authorization. So for example, oral moderate, you need 6 points. If it's parenteral or deep sedation, you need 12 points. So it would say 6 or 12, depending on what kind of authorization you have. And it will tell you how many points you've entered to date that will count towards this total. These are not in addition to your 90 points. These are part of your 90 points. But if you look to the left-hand side, this is the competencies that when you're entering your points, you're checking off various competencies. So you may have taken a course on dental anesthesia. You would check off dental anesthesia up here. And then you would want to make sure you check off RCDSO standard sedation and anesthesia, because that's what's going to trigger this bar to change and include that in your points. This is coming soon. It's not live yet, but as soon as it is live, we will make sure that we communicate it well, and we'll make sure that we help you troubleshoot that if you've got courses that that should be included and they aren't included, that you can go back and make some adjustments. Okay. Just one last question that's coming out in the chat, and then I think we'll move from continuing education. I'm mindful of time, but one last question is, well, do we need to upload everything because of the audits? And the answer to that is no. That's why we do an attestation. When you're entering your points, there's an attestation at the bottom of your entry that says that you are confirming the information that you have put forward is truthful and accurate. And because that is there, then we are trusting that you as professionals are in fact entering information that is truthful and accurate. And that's what we are using when we're doing those audits, so that we don't have to ask you to submit additional copies of your certificates. So we're going to talk now just briefly about the audits. And as I mentioned, this is something that is happening or that happens automatically. You don't have to submit anything. In the past, when we did manual audits, you had to submit extra copies of your certificates. You don't have to do that now. We rely on everything that's in your e-portfolio to drive the audit decisions or the audit results. The audit in December of 2023 was actually made up of two groups of people. There was one group of dentists who were in their usual 3-year cycle. That was the 412 who were in the 2020 to 2023 cycle. There were another 1,276 who had their cycle extended due to COVID. So those people actually had a 4-year cycle because of COVID. So in total, we saw 1,688 dentists that we assessed as far as their e-portfolio was concerned. We compared that cohort to all dentists that are registered with the college, and we do this for a few reasons. One is we wanted to see, is there any significant difference between the makeup of the various cohorts? And it's not because we're doing some sort of a study on it, but what we want to do is we want to learn, are there differences between cohorts that might indicate we need some differences in the supports we're providing? What we found was that in this case, that it was roughly similar to the general distribution. We had 11% specialists, 89% generalists. It was a similar distribution by the type of specialty and by geography, but there was a significant difference in the age, with this being a much younger cohort with about twice as many people in the 30 to 39 age group as in other cohorts within the college. It's important to us because what we want to start over time is we want to start learning, is there anything different about communicating, for example, with people in the 30 to 39 age group compared to others? And as we learn more about that, then we can customize some of our communications. The good news of the audit is that we saw about 93% of people who met the requirements. So they had all, well, so 92.2% met the requirements. They had all 90 points. They had all their category 1, all their category 2, all of their category 3s. So that was wonderful to see. So that's a total of 1,556 met the requirements. We had a handful, about 17, that had a minor shortfall. So they were missing a few points. But we were, from our perspective, if somebody's missing a few points, we're not going to worry about that. We will monitor next time to make sure they get all of their points. We recognize that sometimes things happen and you don't quite get all of your points. When we get into moderate and significant shortfalls, that's where we do want to really focus and make sure that dentists have an opportunity to reflect on, what was the impact that it had on their practice, perhaps of not having that opportunity to earn their continuing education points and participate in that continuous professional development. So what we did was we asked those particular dentists to complete a self-assessment. Simple document, 2 pages, goes through and looks at the types of activities you're engaged in when you're caring for your patients, and it looks at your practice itself. Do you have all of the things in place from a perspective of IPAC and safety, emergency measures, those sorts of things. And then it asks what areas you're intending to do for continuing education in the current or the go forward cycle. So it really is something that really is hopefully helping dentists to sort of just reground themselves so that in the next cycle they can be successful and complete all of the points that are required. A few things that we noticed as we were going through this is that most of the people who were missing points in category 1. So 83% were missing points in category 1. And some of those were ones that I had mentioned earlier. These were folks who said that they were maybe living out of province, maybe they were retired, they weren't able to get their category 1 points. And so we remind people that there are lots of e-learning, there are lots of live stream sessions that are approved in category 1. So even if you don't live in Ontario or practice in Ontario, you still have opportunities to earn those points. Over half, we had 56% of people missing category 2 points. And we remind you that there are a number of places to find sponsors for category 2 points. There can be college approved study clubs. There can be approved sponsors that are through, for example, the ODA component societies. And there are some other websites that we go to. So I wanted to just highlight that these are all places where if you're looking for places to get your points, we'll be sharing some of these resources with you so that we can go forward and help you with that. And then about 3/4 were missing category 3 points. And for that, I'll remind you that category 3 points are actually pretty easy in the sense of I would guess that the vast majority of dentists subscribe to at least one professional journal. And if you read 2 journals regularly over the course of the 3 years, that's going to be your 30 points. So make sure you're giving yourself credit for all of the points that you're actually earning and participating in. Okay. There are a lot of questions coming through, which is wonderful to see. I don't want anybody to feel left out or feel like we're not getting to your question. We're actually going to be sharing with you an FAQ document so that we can go into more of these questions later. Okay. And just quickly, just to remind you, as I think we've gone through most of these things, that you do need to get your points. You do need to explore opportunities for where to get category 1, 2, or 3 points. And if you have questions, ask us. We're always here. We're always happy to help guide you. Okay. So Nancy, do you want to just share a little bit about what we heard?
Absolutely. Thank you. So what is it like to be audited? You'll see some of the feedback we received. This is a new platform, and we recognize that there is a learning curve. Our approach has been and will continue to be to answer your questions, guide you to enter your points, and support you to be successful. Is your cycle ending in 2024? If it is, not to worry, you still have time. But if you haven't accessed your e-portfolio yet, we encourage you to do so as soon as possible so that we have time to work with you. Take the time to explore the ePortfolio and look through the materials on the Help tab. You can download one-page guides on how to enter various CE activities. Susan mentioned a few things earlier that will help. Category 1 courses are listed on our RCDSO website. Don't forget that many courses are available virtually and through e-learning. So even if you are very busy or living outside of Ontario, there are lots of opportunities to earn your Category 1 points. We will send you reminders on a regular basis, but it is up to you. If you need help, we're there. Susan?
Thanks, Nancy. I'm mindful that we've actually had so many questions in the chat, and we've tried to answer as many as we can, that we are very quickly approaching the end of our time together. I'm just going to highlight a couple of quick things about the practice enhancement tool. This is something, it's another component of your requirements under the quality assurance regulation. It is something that all dentists are required to do after they've been in practice for 5 years, and then every 5 years thereafter. I do really remind you that PET is something that folks need to do, and we are working on a new platform. So much like we heard you with ePortfolio, we're still listening. A few things that I wanted to just share with you tonight that are going to be different with the new PET platform is we're moving towards more predictable scheduling. So we used to randomly assign people to the PET, and instead of that, we're just going to go with a regular 5-year cycle. So if you do the PET in 2024, you're going to do it in 2029 and again in 2034 and so on and so forth, just to make it a bit more predictable for you. The other thing we're doing is we're introducing more self-serve functions. We have lots of people who are asking for short-term deferrals of their PET. And so what we're doing is introducing a 3-month window. So once you start the PET, you have 3 months, or you have 1 month to complete it, but you can start it at any time within a 3-month window. So you'll get an invitation that says you must do the PET, you must start it sometime between January and March, for example, and you could start it January 1st, you could start it on March 31st. There's a question in the chat, what is the PET? It's a practice enhancement tool. It's an assessment that all dentists need to complete. Okay, and then the last thing we're going to do is we're going to give you access through the portal so that you don't have a separate password. So please, keep in mind that we want to make this easier, and we will continue to work with you to make it easier, so that you don't have to remember one more password, one more thing. We'll do this as easily as possible. Nancy, if it's okay with you, I think in the interest of time, I'm just going to give a quick little call out here.
Sure.
The PET questions are all written by groups of dentists just like you. And what we're trying now is something a little bit new, where we're inviting you, if you're interested, to put forward your name to be part of our writing group. We're looking for 3 people to write about radiology. So not looking for specialists necessarily. These are generalist level questions. And so if you're interested, please send me an email. My email address is there, and we'll include it in the follow-up. Just send me an email by the end of May. You don't have to say anything, don't need a resume. I don't need anything detailed there. I just want to know that you're interested. And then what we'll do is we'll contact people by the end of June, and we'll be starting this work in September. So what we ask people to do is, as part of this, you're part of a writing group. There's a group of 5 dentists. We give you some training about how to write good multiple choice questions. You'll work with others. There's an honorarium for your time, and it gives you an opportunity to learn a little bit more about the process behind the scenes. Resources on our website, please go to them. There's lots of good things there. Resources on your ePortfolio, there's a help tab there, which gives some step-by-step guidelines on how to enter various activities, as well as a user guide and some general FAQ type questions. I apologize, I know we've gone a little bit over, but that's the end of our presentation, and I'll give it back to Dan now.
Nancy, Susan, thank you so much. That was a very informative presentation. And I think it not only demonstrated all of the information that's available to the profession on CE and PET, but also hopefully demonstrating how we're willing to support and help you in navigating the processes and the content, and to continue to do so. This is not a one and done. There's all sorts of ways that you can continue to ask questions, get your questions answered, and contact us at the college. So to Susan and her staff, and to Nancy and the Quality Assurance Committee, thank you very much. That was extremely informative. As Susan mentioned, you can learn more about our quality assurance program by visiting our website. And if you have any practice-related questions, don't hesitate to reach out to staff in the college's practice advisory service. The email is up there, practiceadvisory@rcdso.org. There were a number of email addresses that appeared on your screen as we went through the presentation. And if you have not recorded them, then just contact the college and we'll put you in touch with Susan or someone else who can answer your questions. You can also follow the college in a number of ways on social media to receive our latest news, updates, and resources. And as I mentioned at the start of the session, for the CE credit, you will need a reference number for the post-event survey, and it's on your screen right now, 2024-0905. That's 2024-0905. Our next college newsletter will arrive in your mailbox next month. I encourage you to read it and get more details on what we're doing to meet our mandate to serve the public interest. And our next council meeting is on June 20th, and you can watch this and all of our council meetings live on YouTube. We're also hosting our first in-person RCDSO Connect session on June 25th in London on Western's campus. You'll be hearing more about this event in the coming weeks, but if you live or practice near London, please save the date in your calendars and come on out. Dr. Carlos Canones and other faculty from Western will be joining us. We'd love to see you there. So thank you very much for joining this edition of RCDSO Connect. Thank you, Susan and Nancy, once again. And hopefully you enjoy the rest of your evening, and we'll see you at the next RCDSO Connect. Bye-bye.